Hello, everyone. This is Leslie, and you're listening to The Interview with Leslie Heaney. November is National Diabetes Awareness Month, and I wanted to do an episode about diabetes because I have several close friends whose children have been diagnosed with type 1 diabetes within the past 15 years. When I was growing up, as an old lady as I am now, I knew of one girl at my school, in my grammar school, who had type 1 diabetes. But it seems as if today the disease is much more prevalent and the statistics around it are pretty staggering. 1 in 300 Americans will develop diabetes in their lifetime, and 1 in 15 will if they have a family history of the disease. And as I just mentioned in my own kind of personal experience, it seemed to me that the cases of type 1 diabetes were on the rise in America. And after doing this episode with these superstars who are on the front lines trying to eradicate the disease, I was correct in my assumption. Cases of type 1 diabetes in America are on the rise, and there's no known cause. So in this episode, I speak with 3 incredible women who, as I mentioned, are on the front lines working to eradicate this disease: Allison Aston, Dr. Natasha Leibel, and Lynn Starr. Allison is a parent of a child with type 1 diabetes, and through her work at Veronica and as the sort of head of their VB Gives Back program, she has raised hundreds of thousands of dollars for diabetes research. Dr. Natasha Leibel is a superstar diabetes doctor and the director of the pediatric diabetes program at Columbia University Irving Medical Center. And last but certainly not least is Lynn Starr, who is Breakthrough T1D's Chief Global Advocacy Officer. And both Lynn and her daughter are type 1 diabetics, having been diagnosed as adults. So in this episode, I speak with Allison and Dr. Leibel and Lynn Starr about what it's like to be a parent with a child who's managing the disease. We talk about current treatment options. And then we talk about the exciting new therapies that are delaying the onset of diabetes and the groundbreaking research that could lead to the eradication of this disease. We should all learn more about diabetes. We should all work to get involved in this fight. Just anecdotally, I've noticed over the past 15 years, having friends go through it, they're making such incredible strides and gains towards finding a cure. It's a really exciting time to be a part of this fight. And this episode will not only inform you about diabetes, but also, I hope, inspire you to help get involved and help this group of incredible people find a cure. So nice to see you all here. Thank you so much for joining. We have Dr. Natasha Leibel, Lynn Starr from Breakthrough, and Allison Aston, who is very involved in raising awareness and funds for diabetes and has a child who has type 1 diabetes. So just so delighted to have all of you here today for this very important conversation during November, which, as I know you all know, is Diabetes Awareness Month. So I'm so excited to be sharing this information with our listeners. I thought it might be helpful, Dr. Leibel, to start off with you. If you could just sort of set the table for listeners and explain, because I think there is some confusion among lay people about diabetes type 1, type 2. If you could talk about that and talk about any known causes.
Sure. Well, thank you so much for having me. So diabetes is a condition when the body's blood sugar goes too high. So throughout evolution, right, our bodies have been developed in such a way to keep our blood sugar in a very tight range. So 70 to 140 milligrams per deciliter is really where the blood sugar should live in very scientific terms. So diabetes is when the blood sugar goes above the normal range. And our blood sugar is controlled by this hormone called insulin, which is produced in a cell called the beta cell in our pancreas. And that beta cell is the only place in our body that makes the hormone insulin. And when it's released, it is released in response to the food, predominantly carbohydrates, that we eat. And insulin's role is to allow the sugar in our bloodstream to enter our cells where it's used for energy. So type 1 diabetes occurs when the beta cell no longer is able to produce insulin. And we call type 1 diabetes an autoimmune condition meaning that for some reason, our body has attacked those beta cells so that they no longer make insulin properly. And why this really happens is not fully understood, and I'll talk about that more in a minute. Type 2 diabetes generally occurs when we can make enough insulin in the beta cell, but the cells in our body are actually resistant to that insulin. So the cells don't open their door to let the sugar in, despite the fact that there's a lot of circulating insulin. And this is what we call insulin resistance, and it's very tightly linked to excess body weight. Now, type 1 in the past has been thought of as being what we call a juvenile disease, meaning it happens in children. It used to actually be called juvenile diabetes. But half of all cases diagnosed every year are actually in adults or people over the age of 18. And type 2 diabetes does occur sometimes in adolescence, but is predominantly found in adulthood. So why type 1 diabetes occurs, as I mentioned, is not really fully understood. We know that people who get type 1 tend to have a genetic profile that predisposes them to developing it. And then something in the environment, what that is, we don't know, triggers that attack on the beta cell. And we do know that developing type 1 diabetes is never anyone's fault. It does not come from ever eating too much sugar. That does not cause type 1 diabetes. And it is really, unfortunately, nothing that we can prevent at this point. What we can do is actually in high-risk people, meaning people who have a family member that has type 1, we can screen those family members to check for their risk of developing it. But unfortunately, at this time, we cannot prevent it.
Sorry to interrupt you, Dr. Leibel, in the middle of a thought, but, is there a rise in the number of cases of type 1? You mentioned that half of the individuals who are diagnosed are over the age of 18. I anecdotally, Allison being one, have 4 people, friends of mine, and 2 very close friends of mine whose children have type 1. And I don't recall, when I was growing up, I knew of one girl who had gone to my school who had type 1 diabetes. Is it on the rise?
It absolutely is. So there are about 37 million people in the country living with diabetes. About 5 to 10% of that number have type 1 diabetes, and it is on the rise. Again, no one is really sure why, but it absolutely is. And it's particularly rising quickly in very young children, so children under the age of 6 years old. We're seeing more young children being diagnosed with type 1.
And for people who are listening who have children, or for themselves, because you mentioned adults are also half of the group that is being diagnosed with type 1, what kind of symptoms should people be looking for?
It's an excellent question. So the symptoms are pretty classic. It's what we call polyuria, meaning going to the bathroom too much, peeing too much, polydipsia, drinking too much, and polyphagia. It's being extremely hungry. And generally what we see is that people are very hungry and they're eating constantly, but they're losing weight. And the reason that they're losing weight and drinking so much is that, remember now, their blood sugar is high. This sugar is being filtered through their kidneys, where the kidney can't hold on to all of it, and it pulls water with it into the urine, basically. It's making your urine, and so all the calories you're eating, all the sugar is actually just going into the urine. So you're losing weight, very thirsty, and peeing a lot. Those are the typical symptoms. If it's left undiagnosed for too long, you can actually go into a critical phase of type 1 called diabetic ketoacidosis. And that's an extremely dangerous, life-threatening condition where the acid in your body builds up too high and unfortunately, can have very unfortunate consequences.
I think without jumping around too much, to just sort of kind of continue the conversation there a little bit, I think that was one of the things that your daughter, Audrey, had. Am I right about that? That she was very close to Dr. Leibel, repeat that. It's called ketoacidosis. Is that
diabetic ketoacidosis? Yeah. Yes, and it's a life-threatening condition. And I just want to mention, you cannot live without insulin. So insulin is necessary to live. So diabetes is a condition when not properly treated. Either the blood sugar goes too high or too low. Those are life-threatening situations.
Allison, am I wrong about that? I recall that.
No, that's exactly correct. Actually, Audrey was at camp exactly 3 years ago, July 3rd. We got a call where they thought she had a very, very severe stomach virus. And it was like, until those COVID days where you're like, really? Is she your patient zero after 6 days of, isolation? And they're like, yeah, she's our patient zero. I'm like, okay, all right. And then very, very quickly, 8 hours later, she collapsed and she was rushed to the ER. And at this point, we're still thinking maybe it's an appendicitis. Maybe it's something else because, she had been exhibiting all the signs that Dr. Leibel had been talking about. And, before going to camp, we didn't pick up on any of them. Drinking too much, peeing too much, all of that. Those were all signs that were visible. She was skipping meals. She had headaches. It was summer, so we excused so much of it. And then on this fateful day, when she did collapse, and it was very serious, and she was unconscious, and, they brought her to the ER. They were still running tests. They didn't know what was going on. And this one doctor said, you know what, let's finger prick her. And she had been there for a good 20, 30 minutes at this point. And they did. And right away, within seconds, we knew it was type 1. She was immediately helicoptered to a pediatric ICU where she, embarked on this journey. And as parents, we had no idea what was going on. We literally had no clue what type 1 diabetes was. I had heard about it, in the back of my mind, but never, ever had that experience firsthand within our family or, immediate friend group. And so, it was a fateful day. And I'm happy to say that was our first day and we live on to tell the tale.
Well, I seem like I'm a bad luck charm because I happened to be with you when you got the phone call from camp.
Yeah.
And I just remember and then the days that followed, and I'm sure, Lynn, we're going to get to you too, that you've had that experience with your own daughter and with yourself, just sort of that initial shock and awe, and then the learning curve that occurs, right, for people who are diagnosed, because there's so much that goes into managing it, which kind of gets back to the importance of us finding a cure here, because it is so life-altering. Dr. Leibel, for people that have it, what are the treatment options? We know that it's this lack of insulin production. What does the treatment look like today?
Sure. So the only treatment for type 1 is injecting exogenous insulin. So you have to take insulin to live, and that is the only treatment. There are no alternatives. There's no other treatment. People ask, but this is the only one. So, and it's very burdensome. It really, to take care of your diabetes well, to be in good control, to keep your blood sugars under good control, you have to take insulin before every single time you eat, and you have to know what your blood sugar is throughout the day to make sure it's not going too high or too low. So there's 2 ways that insulin is given. It can be given via injection with an insulin pen or a syringe, or we have insulin pumps. And pumps are small devices that have little catheters that are inserted under the skin. And this allows for little boluses of insulin to be given every time you eat or if you have a high blood sugar. And these catheters are changed out every 2 to 3 days. So the appeal of the pump is that you don't have to give injections to yourself 5, 6, 7 times a day every time you eat. Most people with type 1, or many people, especially in this country, are wearing also what we call continuous glucose monitors, or CGMs for short. And these are little devices. They're like the size of a quarter. They stick onto your skin and have a very small catheter also that goes right into the skin and reads your blood sugar every 5 minutes to your phone, can read to your parent's phone. If you're a child, your parent wants to follow your blood sugars. And the most advanced technology today are these CGMs speaking to the pump. So via Bluetooth, the CGM will read to the pump what the blood sugar is, and that pump, based on if your blood sugar is rising or dropping, will give you more or less insulin. It still requires the user to get involved and to take a bolus if they're going to eat, et cetera. But it does allow for overall, I would say, better glucose control.
And how long has that technology been available? Because I'm there just by watching friends who've been back to, doing the shots and having there were these Labrador dogs that I'm sure you can still get them. You probably don't need them now with all this technology, but that could help smell when your blood sugar dropped and then let someone know because, and I know, Lynn, you've probably been through this with yourself and your child, and Allison, I know, has with Audrey, is just monitoring. In the beginning, I think you as a parent are monitoring constantly, right? Because you just don't want to get it wrong. You want to make sure that you're there. But do these kind of take the place of that?
Yes. So, prior to CGMs, we had parents who were checking their child's blood sugar by finger prick every hour for 24 hours a day. I think to let a child go to sleep and not know what their blood sugar was is one of the most unnerving experiences as a parent. And most parents who have a child with diabetes have spent some sleepless years. And so CGMs, because they alarm if your blood sugar is dropping too high or too low, at least can reduce some of that. These very new devices, what we call hybrid closed loop, where the CGM reads to the pump, I would say have been around for about 5 years or so. So
anyone who has children knows the newborn phase. It's kind of like we block it out just so we can get on with our lives because it's so traumatic. But being up every 2 hours to feed a child or 3 hours, that stress is nothing compared to the stress of having to check your child's blood sugar. Because if you get it wrong, right, or you're not monitoring it, there can be some serious consequences.
Yeah, there's no getting it wrong, right? Dr. Leibel we're so lucky to have Dr. Leibel in our lives, and she was there on Audrey's first day, and she's been there ever since. And the first years are like, I was a deer in headlights, really. Yeah. My husband and I were both deer in headlights. We didn't really understand what was happening. And I remember Dr. Leibel saying, we gotta teach you to walk before you run. So do you remember that, Dr. Leibel? Yeah. She's like, you're going to test her blood sugar every few hours before she works out, before a meal, after a workout, and it was like this real understanding that we got around how different activities, how different foods affect the body. And you really start to kind of understand that in a very slow way. And then when we were introduced to the glucose monitor, that was like that was like, that alleviated a lot of, the math and the monitoring, because it happened very automatically. And then all of a sudden she got this pump, and it was like, Jesus had arrived, right? It was life-changing. And then, you start to realize this technology that we are now very accustomed to 3 years in, never happened 5 years prior. Like, Lynn can talk about, the early days and with her daughter, they didn't have that. And so I'm so grateful for the technology because it enables us to, just kind of go through our day with a little bit of reprieve. It doesn't change the, extensive nature of the disease, right? She still has to do all her things, and we still have to monitor and keep track, but it really is a life changer in terms of being able to breathe at night, as a parent.
And to give her some autonomy, right? And, and independence. That's part of it. I think when they get to be teenagers, I just observed this sort of from the sidelines, but you want them to be able to go to that sleepover or go, live their life. But so this technology allows them to do that. So Lynn, you yourself have type 1 diabetes. You've probably lived through all of these You probably have a Labrador sitting under your desk right now. I mean,
I wish I had a
tell us
Labrador
everything.
sitting under my desk right now for many reasons, but
I was going to say I have 2 at home. If you need, you want one, just to,
I have a
to
Labrador.
rent.
And she'll do.
Okay.
So I have been in this role as Breakthrough T1D's Chief Global Advocacy Officer for about 1.5 years. But as you say, I'm not new to type 1 diabetes, and I'm actually not new to this organization either. When I was first diagnosed 35 years ago at 27, and as Dr. Leibel said, about 50% of people who are newly diagnosed are adults. So I was 27. My great endocrinologist, my Dr. Leibel, said to me, I was a young lawyer here in Washington, D.C. My family wasn't here. I didn't know many people. He said, you have to get involved with Breakthrough T1D, which was then called JDS, or Juvenile Diabetes Foundation, subsequently became JDRF. And so I did, and I jumped in, and this organization really became my family and my support system, and I'm eternally grateful. I stayed very involved in this community. My whole career has been in advocacy in Washington. And so when this opportunity to actually join presented itself, I couldn't look away. And it's so incredible to be doing this work at the leading global type 1 diabetes research and advocacy organization. 2 weeks after I started, my daughter was diagnosed. We can't make it up, right? At 27, almost to the day of when I was diagnosed, her doctor did a random test. And, this happens a lot. Dr. Leibel, I'm sure you can speak to this. Jamie, my daughter, called me and said, Mom, I have pre-type 2 diabetes and I have to see a nutritionist. There's a lot of misdiagnosis of type 1 diabetes being diagnosed as type 2 diabetes. And I said, yeah, you don't have pre-type 2 diabetes. And sure enough, it was type 1 diagnosis. And so she now also is on insulin. Her experience was so different than mine. And I'd be happy, if you're interested, to talk about what it was like 35 years ago when I was diagnosed compared to what Jamie's experience is today. It's not easy. It's still incredibly challenging, and it's still incredibly dangerous. And I think as part of Diabetes Awareness Month, it's important for people to understand that. The technology has improved dramatically. It's become easier, but the challenges are still real and profound, and the life-threatening nature of this disease is still very real. So our mission at Breakthrough T1D is advancing life-changing breakthroughs to cure, prevent, and better treat type 1 diabetes. So this past summer, you may have heard of our organization as JDRF, which, as I said, was Juvenile Diabetes Research Foundation. We changed our name. We changed our name because about 50% of newly diagnosed people are adults, and juvenile diabetes isn't a thing, actually. We used to think it was a thing, that type 1 diagnosis was only in kids. But now we certainly know better. And we needed a name that reflected our entire community, that brought the whole community in to the work and advocacy and research that we're funding, and to feel a part and represented. And so Breakthrough also really represents the actual work that we're doing, advancing life-changing breakthroughs. We've had an incredible response to the name change, and this is an incredibly exciting time in type 1 research, advocacy. I'm happy to talk to you about some of the exciting things that are happening right now in type 1 diabetes.
Yes, I want to hear all about that. I do want to, though, I'm really struck by what you just were explaining about your daughter being diagnosed at the same age that you were. And Dr. Leibel, you said earlier that, Lynn, maybe you know this too from all the work that you're doing, obviously, with Breakthrough. You mentioned there might be some genetic component and then environmental factors might turn it on. Lynn and Jamie, I hope you're in some sort of a trial. I feel like just because being mother-daughter and then being the exact same age is, have you identified a gene or a link or?
So one of the things about diabetes that's very important, to understand is that there is not one gene that causes type 1 diabetes. There are many genes that are contributing to the risk and to why people get type 1. And that's something that I think also makes it difficult in terms of, curing it. But one thing we can do is screen family members for what we call the antibodies. The antibodies are a sign that those beta cells are under attack. So as I mentioned, type 1 is what we call an autoimmune condition that the body is now attacking those beta cells. And there are markers of that attack, and you can measure those in people. And people who have a first-degree family member with type 1 are at an increased risk of developing type 1. So it's about 1 in 300 in the general public and about 1 in 15 if you have a first-degree family member. So there is a worldwide study going on that is looking at screening first-degree family members. And you might ask, why do this, right? Why would we do this? And one is that if you know your risk, you hopefully can prevent, for example, what happened to Allison's daughter, right? Where you get very sick and you end up with a life-threatening diabetic ketoacidosis situation. And secondly, there are clinical trials and even one drug that is trying to slow the progression to full-blown diabetes. So these are all things that are going on in sort of the scientific world that are really important for people to understand.
If I can jump in here for a minute, because this is actually an incredible advance. So we talk about preventing type 1 diabetes, and the first FDA drug that delays onset of type 1 diabetes was approved last year. It's called Tzield, teplizumab, that is its formal name. This drug is in a 14-day infusion. It delays onset for about 2 to 3 years. Now, that's not preventing it from ever onsetting. But you can have a soft landing. You won't have diabetic ketoacidosis, DKA. You'll know when you'll have a continuous glucose monitor. You'll know when you're going to have a need for insulin. You can participate in clinical trials, as Dr. Leibel said, that really can help advance the science around this. And you can just have peace of mind for a longer period of time. Right. If you have a small child, 2 to 3 years, Allison, I'm sure you would say, if you could have delayed the need for insulin for 2 to 3 years, you would have taken it. And this is an incredible advance. And this is the kind of science that Breakthrough T1D is funding, that our government is funding through the Special Diabetes Program, which contributes a lot of money towards type 1 diabetes research. There are really exciting things on the horizon. So early detection and screening is a thing now. And it's important for people to know about that and be able to take advantage of it. It's no more than a fingerprint.
Yes, I mean, it's interesting, but like when you don't have any family history and when we didn't have any family history. So
but
even
just, right? Now you do.
No, of course. Now we do. But, to be able to even just educate, like the fact that the camp didn't realize her water bottle was like a 40 liter, she was drinking a gallon of water a day. Like the signs were all there, and yet nurses missed it. Even the first ER, for the first 2 hours missed it. And so there, if you don't have a family history, it's still one of those things where we need to get the message out. Like, what is type 1 diabetes? Why? It's like everyone understands celiac and everyone understands, thyroid disease, and yet type 1 is one of those things where people are still eluded. We were fully in the dark. And she had gone to her doctor 6 weeks prior to July 3rd. And so I know that she was healthy and then she wasn't, right? And it's very, for families who don't have the history, it's confusing.
we think there should be just screening as a matter of course, right?
Totally.
There's a lot of clinician education that has to happen here. Dr. Leibel,
Well, I was going to ask you both, Lynn and Dr. Leibel, with that test, you mentioned it's just a finger prick rather. Is it something, would Audrey, had she had that, they go into the pediatrician and they'll have the eye test or they'll do a finger prick for something else. I forget what it is. Would this be something that would have been picked up 6 weeks prior? You would have seen that she was becoming to be resistant at that point?
No, that's a very good question. And I think exactly what Allison, I just want to go back to what Allison is saying is so, we hear this all the time because it's so true. Most people who are diagnosed with type 1 have no family member who has type 1, right? That is by far the norm. Whereas type 2 is very different. And often type 2, everyone in the family has type 2. So they're not so shocked when it shows up as a diagnosis. But in type 1, they normally don't. The issue is that antibody screening, which is really the way you have to do the diagnosis, just doing a random blood sugar is not usually going to catch it. That's not a safe way to try to screen the population for type 1. So it really is this antibody testing. And I think it will get there. It is not there yet for prime time for general pediatricians to be screening children for this. And I don't know, Lynn, if you would agree with that. I think we're on the cusp of possibly being able to do some form of population testing. It's very expensive and the results need a lot of interpretation.
Well, it's definitely not there in terms of pediatricians doing the screening. And I'm sorry if I didn't mean a blood sugar glucose level.
No, I know you didn't. Right. It can be done with a finger prick.
The antibody test can be done with just a finger prick and you collect a little bit of blood in a tube.
That's right. I knew that's what you meant.
Yeah, that's what I was referring to. But there is great accuracy now on the screening and early detection. And we're definitely advocating for more screening. And there's a new bill in Congress now that it's called the Screen for Type 1 Diabetes Act, that would put $5 million a year for 5 years to the CDC to create an education campaign to increase awareness about the availability of type 1 screening and early detection. It's not like what we used to think about. One day you don't have type 1 diabetes, the next day you have type 1 diabetes. There are stages of the development of the disease. And if you can catch it at an early stage that this is developing, you can take action. You can prevent DKA. You can delay the onset. You can participate in clinical trials. These are all really significant and profound developments. And more will be coming. This is just the first onset delay therapy that's been approved by the FDA, but there are more in the pipeline now. So this is exciting.
Tell us about the work that you mentioned. I know you talked about maybe lobbying for Congress or talking about that bill and them allocating more funding to the CDC. Tell us about the other work that Breakthrough does, because I'll just, again, anecdotally watching friends who've been involved with the organization, it is a family. I mean, they feel so passionately about it. They engage in fundraising. It really provides an outlet and a venue for people to get involved, for families to get involved and to make a difference in a way that I haven't seen other organizations engage families.
For sure. When you meet someone with type 1 diabetes, whether your child has it or you live with it, as we say, out in the wild, there's an immediate connection because we get it. And we get it here at Breakthrough T1D and our whole community. I personally, our whole Allison, I'm sure you feel it too. The connection is profound. And so the work we do.
And it's immediate. It's immediate, to your point. When you meet someone whose daughter, who they themselves, it's like you have this instant connection. Absolutely.
Yeah, for sure. I have so many stories I could tell. Our time is limited, so I'm not going to digress into some personal connection stories, but it really is amazing. So what we do at Breakthrough T1D is we fund research and we fund advocacy. We fund the work that researchers are doing. So the more money that we can put towards type 1 diabetes research, the more research there will be. So a big part of what we do is fundraising. We have 29 chapters across the country. who all engage in a range of fundraising activities. Allison is particularly involved right now in a gala event that will be happening on November 14th, and we're so grateful for your work on that, Allison. We have walks around the country. We have bike rides around the country. There are tons of opportunities to participate as a contributor, a supporter of Breakthrough T1D, but also through advocacy. We have a grassroots volunteer army spread out all over the country, really all over the world, that helps amplify our policy positions as we advocate to government, Congress, regulatory agencies. And people can sign up to become a Breakthrough T1D advocate. You just go to our website, breakthrought1d.org/advocacy, and you can sign up. And so what does that mean? You'll get updates on our policy positions. You'll get action alerts to contact your member of Congress. And I'll talk about one of the specific ones that is out there now. You'll have opportunities to help support our mission. So fundraising is a big part of what we do. Breakthrough T1D has contributed over $2.5 billion since 1970 towards type 1 diabetes research. But we can't do it alone. So we advocate for government funding in the US, but also around the world to support this research. And we were one of the leaders in creating a congressional program called the Special Diabetes Program, bipartisan program started in 1997. $3.5 billion has gone to type 1 diabetes research through this program. This is really significant. The SDP, Special Diabetes Program, helped fund Tzield that delays the onset, helped fund the automated insulin delivery system that Dr. Leibel talked about, where our pumps can communicate with our CGMs. We can't do it without this government funding. We can't do it without our supporters' contributions, but we can't do it alone. So this government funding is really significant, and it's expiring at the end of this year, at the end of December. So we are right now in a huge push to be sure that Congress extends and ideally even increases the SDP so that we can continue to put these kind of funds towards this critical research. So that's a big priority of ours right now. I mentioned the Screen for Type 1 Diabetes Act. We're very engaged in insulin affordability to be sure that everyone who needs it has access to affordable insulin. That's a big priority for our organization. And again, the screening and early detection awareness is a big part of our work right now.
Could I ask about that accessibility piece, Lynn? Does insurance cover this more modern technology, monitoring technology for diabetics, the pump and the...
Yeah, so a lot of what we do is about access, to ensure that people have access. We have a whole team that works just on access. They work with insurance companies, they work with employers to be sure that the policy plans are favorable for people with type 1 diabetes. We were able to secure Medicare coverage for automated insulin delivery systems, which was a huge need.
That's terrific.
And something that we worked so hard on. So access is a big priority for us here at this organization. Most plans will cover. We also need to ensure that there's choice, because as these things have come to market, now there are multiple options for them, which is amazing. Breakthrough T1D played just a huge role in getting these through the FDA. And so for us now to see that this market has developed so significantly is quite gratifying and so important for our community. So it's access and choice are really critical to the work that we're doing.
Now, is the research looking at what turns it on? Because Dr. Leibel, you mentioned like sort of it's beginning to block. I don't want to get the science wrong. It's not a beta blocker, but is it looking at that environmental factor?
Are trying to figure out what the trigger is. Right? That starts that autoimmune attack on the beta cell. And many studies have been done looking at this. And there is no clear answer here. Many, including early cow's milk, including viruses, including hygiene hypothesis, all these ideas that are, possible that there are viruses that start the trigger. It's just not totally well known.
No, it's not. But the research in cures therapies is really the highlight right now, and so incredibly exciting.
when you say cures therapies, you mean the delaying of the onset?
No. I mean developing insulin independence so that we no longer have to inject insulin, that our bodies start making insulin again. We are at a golden age of science around this. In the last 2 weeks, I visited 2 different labs that are making insulin-producing cells. They're making insulin-producing cells that could then be implanted in an individual with type 1 diabetes and make that person insulin independent again. One company, Vertex, just announced that they're going into what's called their pivotal trial, a phase 3 trial at FDA. They've already been through 2 phases for this drug therapy, this cell therapy. This is the trial that post this, you apply for approval from the FDA. This is the first time in history that a cell therapy that does this has gone to this phase at the FDA. So this is an incredibly exciting time in the science. We know science and researchers will find a cure for type 1 diabetes, but advocacy is going to bring it to the people who need it. This is a 2-part project.
Right.
The science without the advocacy and access, this may be too strong, but is almost meaningless if the people who need it can't get it. So this is the work that Breakthrough T1D is doing across the board, funding the research, funding the advocacy so that we can tie it up in a bow and be done with this, which is what we all want, right? I mean, we all really want that. Sorry, Dr. Leibel, you'd have fewer patients and we might not have the organization at Breakthrough T1D. But
I want to put you out of business, Dr. Leibel. Yeah, no. But
you know, can I just say, I mean, I think that one of, the hardships is that people who have type 1, right? I look at my daughter and she walks around and she walks proud and she has this and she, like Lynn, just gets it done. And like Lynn's daughter and like all of Dr. Leibel's, patients, they walk around and they get this done whilst, conducting their lives. And that is the part that I am in awe of, that you have to live your life like the way you want to live it, right? Like going after your dreams and studying and pursuing all your passions. And yet you have this whole other side of you that is a priority, because if it's not, you don't live another day, right? And that, to me, her father and I are always looking at her in such awe. I mean, really like awe, like that you do everything that you do and you manage this, whole diabetes. And I think that that's one of the things that's a problem. It's not like you walk around looking sick. You don't walk around looking like you need help. Like these millions of people are walking around, living their lives, doing their thing, and they're managing it at such a high level because they have this whole other life-saving thing that they got on the side. I mean, that's the most amazing thing to me. And I think that's why...
that, Allison. Really, thank you for acknowledging that.
It's so true.
People with type 1 diabetes have to make, I think the number's higher, but have to make 180 decisions a day more than people without type 1 diabetes. I think the number's higher. But and that's why cures are really what
so important.
What is guiding us to, until we get to cures, we need to improve lives for people with type 1 diabetes, and we're working hard on that. But the end game is cures and taking off our pumps. While it's so great we have them, nobody says, I would love an insulin pump. Can I have one? That's why we're doing what we're doing.
But besides the decision making and the stress of it and the monitoring and all of that, it also is putting a stress on your body, right? I think that's part of it for people who are not as closely, have a personal experience or know someone who has it. Think, oh gosh, well, diabetes is managed. Like we don't have to worry about focusing on diabetes awareness or finding a cure because they have insulin pumps and it's inconvenient, but it's fine. And it's not. I mean, it's life altering. And it also, I think, in Dr. Leibel, you could speak to this. I'm sure Lynn Allison, you could too, but it's also putting a strain on your body having type 1 or type 2.
Well, first, I just want to go back just to say what Allison was saying. And her daughter and my patients, my other patients are really my inspiration in life for what I do, because they are living their life with such grace under this burden. And just as you said, going about their day-to-day life, and they're just so inspirational. So really, and our dream, at the Naomi Berry Diabetes Center here, is that one day we become a bowling alley. That's what we always say, right? We're just hoping one day that the doors can close. That truly is our dream. But I think that, with people with type 1, yes, they can keep their diabetes in good control and try to avoid the long-term complications, but the burden of doing so is very high. And if your blood sugar is not well controlled, the long-term complications do include the very unfortunate consequences of blindness, of amputation, of heart disease, stroke, nerve damage. These are all, consequences that were at one point inevitable. And in the era now of the technology we have are preventable, but it is a tremendous burden.
Type 2, we didn't get to type 2 at all. I just you mentioned, Lynn, that your daughter was misdiagnosed as having type 2. There are, I know of people who've been told by doctors that they're on the cusp. Is type 2 diabetes reversible if you have it, or once you have it, can you not go back? What is the science with that?
So type 1 is not reversible and it is not curable. Type 2, the way I like to explain it to patients who have type 2 is that it can go into remission.
Okay.
So that your blood sugar can go down low enough into the normal range for a long enough amount of time that you always have it, but you're able to manage it in sort of an easier way.
Because you're still making insulin, right? That was the distinction.
Yes, it's an extremely complicated, and I think, very complicated situation. In the beginning of type 2, they're generally making enough insulin. If you have it for long enough, you actually often stop making enough insulin, but that's probably beyond the scope of sort of what you want to know about. But yeah.
So Lynn, with all of your work that you're doing with Breakthrough, people that are listening that want to get involved, that want to help, and with all of the advocacy with this, wanting to continue this initiative with the government and have them, are you asking Congress to re-up for a certain period of time with that funding initiative? Tell us about that and tell us what people can do.
With government funding generally, it is a challenging situation. It's complex. And as we now look to a new Congress, it's likely to become even more complex. So we would love a multi-year renewal of the special diabetes program at an increased amount. But government funding lately, in the past few years, has been done through what's referred to as a continuing resolution, which extends the existing government funding for a period of time. So if there's a continuing resolution, a CR, the current special diabetes program will be extended, we certainly hope and we expect, for however long that continuing resolution is in place. But ultimately, our hope is to have a multi-year renewal so that we don't have to, every 6 months or even every year, go back and push for this. The good news is we have widespread bipartisan support. Our issues are all bipartisan. Type 1 diabetes doesn't discriminate. It doesn't pick Republicans. It doesn't pick Democrats. If anything, men have a little bit higher incidence than women, but everyone who knows someone with type 1 diabetes, and most people do now, are supportive. And even if they don't know someone, are supportive of our mission, of our work, and in Congress of the special diabetes program.
Well, for everyone listening, I know you can go to Breakthrough's website, right, to get more information about that or to sign up.
If you go to breakthrough-t1d.org/advocacy, you can sign up to become part of our grassroots army, part of our grassroots advocacy team. And that I would love everyone who's listening to do that.
For sure. And then Dr. Leibel, if you have a family member that has diabetes, you should get screened as a takeaway?
I believe you should, yes.
Yeah. And you
that's
could talk to your
discussion
general
to have with your
practitioner?
endocrinologist, what the
Okay.
screening entails and what it tells you. And yes.
Okay. Well, thank you so much, all of you, for taking the time. It's an important month. It's a very important topic. And I am just so impressed by this community. I'm so impressed by the incredible work that you've done. Again, I've just had another close friend like Allison, whose daughter has type 1, and I've watched all of the incredible advances that have occurred over the past 15 years in her treatment. So, Lynn, what Breakthrough's doing is working, and Allison, all the work that you do to raise money for this incredibly important organization is paying in dividends. So keep up the good work. Dr. Leibel, I mean, I hate to say it, we do hope your office becomes a bowling alley, and, we're
Fingers crossed.
but in the meantime,
I'm bowling there any day.
yeah, exactly.
That's right.
But in the meantime, we're so thrilled that you're there on the front lines, being such an incredible guide and doctor for all of these children and adults who have type 1. So thank you all so much for joining. Allison, thank you for coming in at the last minute, live from London. So thrilled to see you all, and really appreciate you being on the podcast today.
And thank you to you, Leslie, for highlighting this in such an important month. And really, this is all about awareness. And thank you for your dedication to your community and your friends and everything that you stand for. So thank you.
Oh, love you. Stop it. Stop it. You're going to make me cry in the podcast. That brings us to the end of this episode of The Interview. A huge thank you to Allison Aston, Dr. Leibel, and Lynn Starr for joining. And as always, thank you all again for listening. If you enjoyed this episode, I hope you'll rate and review us on Apple Podcasts or Spotify or wherever it is you get your podcasts. A new episode is released every Wednesday. And until then, this is Leslie, and thank you for joining The Interview.